Dr. Jonas Apostol. Hi guys, so happy Halloween. So this is my first vlog on the month of November, and I am so happy and excited to share with you this case. This case is like about the shade or the color of the teeth, which is very white. So usually, if the patient requested for a white shade of the teeth, I don't really like the idea of that. But with the advent of modern dentistry, especially in ceramics, and what we've done in our clinic or in the laboratory, in my laboratory, we've invented a natural looking yet super white shade which will match the totality of the face. So I don't usually do a BL1 shade of veneers because it's really difficult to blend with the overall structure of the face regardless of the skin tone. May binabagayan talaga, like the youth, the personality, also the kind of work that you're in. So we have to analyze everything before we can consider doing such a brilliant smile or super white smile. So this patient came from the north, super layo pa, like 4 hours, 5 hours travel by car. So she's really excited to have her teeth done with me, maybe because of some successes that she has seen in some of my portfolios in social media. She really requested for a really white sets of veneers or teeth. So this is a case of a 25-year-old female patient with the chief complaint of having this small, asymmetrical, and yellowish sets of teeth. And she wanted to enhance everything, the color, the gums, the shape, and the morphology of the teeth. So let's discuss or break down the case of the patient. As you can see here, the size of the teeth are not symmetrical, okay? I mean, the upper left quadrant area, medyo mababa yung ngipin compared to the other side. It's called altered passive eruption, no? So it has something to do with the failed to erupt apically yung gingiva or the gums. Sometimes it could cause some problems such as like easier for the food to accumulate inside that area, and for some problem naman, aesthetics talaga kasi it tends to appear to have a smaller sets of teeth, which in the patient's case, parang gums lang talaga. It's not really true enough na maliit yung kabilang side. As you may notice as well, that there are gaps, especially on the in-between lateral and the canine areas. And medyo, she's not happy with the alignment of her teeth, the sets of her teeth, the morphology and anatomy, the sizes, hindi siya masyadong happy. And also, syempre yung color. Binabalik niya sa akin palagi that she's not like happy with the color. And I'm trying to convince the patient to have a more natural color like B1 or bleach white 4 if she really wants to have a very white teeth, which is very natural looking in relation to the skin tone, in relation to the age and the personality as well. But yeah, she was really insistent or clear in her mind about what she really wants for her brand new smile. Of course, we checked everything. Clinically, we checked if there are cavities, gum problems such as gingivitis or pyorrhea or something. We also took a periapical x-ray to make sure that we check the teeth individually. We have to make sure that there are no dental pathologies that would create problems in the future, because we are trying to create a teeth that would last for a very long time. So we have to make sure that it is, number one, healthy. Okay, so that's the first thing that we have to do, assessment talaga, no? Before we can proceed with something like smile makeover or something na restoration. Yeah. Hi guys, I'll be doing smile makeover today. So this is the wax up. So it's not really about the wax up, no? Because I'm doing it in the patient's mouth we're using composite material. Why? Because it's more predictable This one is for the patient to be able to gauge the possible outcome of the result of the veneer. So it's just another way for them to visualize. So after thorough assessment and everything, we've come up with a treatment plan, no? So the initial would be 10 because of the color, but she wants 8 lang muna. So we did 8 unit veneers. It's a lithium disilicate material or Emax porcelain I used for this specific case, no? And also a gum contouring. I actually cut a little bit on the altered passive side. Mas madami, mas malaki konti than the other side. Pero it's like minimally invasive procedure wherein I don't need to cut a portion of bone. So ano lang siya talaga, like ultra conservative approach. So when I design the patient's case, I make sure that it will really improve not just the appearance of the teeth, but also the totality of the face. So that's why I always take repose position. Like I need to make sure that there are a little bit of show of the central incisor when the patient is in relaxed position when she opens her mouth. So I'm considering like about 2 to 3 millimeter show. It really depends on the personality, no, and the age of the patient. So when I checked on her case, medyo may show naman. So what I want or what I did to this patient is we lengthened the teeth pero hindi siya incisally, hindi siya pababa, but apically, pataas, by removing a portion of the gums to lift the smile, lift the gums, and also add length to the veneers. So the procedure was under local anesthesia. It's painless, of course. The procedure, the preparation, everything lasted like around like an hour from start to finish, from the anesthesia to temporization.
1 week later.
So this is the unglazed version of the veneers. Of course, when I do my veneers, I don't like give all authority to my team or ceramist because I know the case. I do adjustment and modification in the patient's mouth when I do my try-in. Okay, that's very, very important. I modified it a little bit with the height, the size a little bit, and also the thickness. So, para at least she's more happy about it.
2 weeks later.
So this is the result after 2 weeks, no? 2 weeks after the cementation. So it's kind of white, it's super white. I used the bleach white one, which is the whitest color available in the market. And I used a bleach white cement. But the trick with this case is that I put some translucency to make sure that it will not look super fake, okay? It's white, but it blends well with the patient's smile. It blends well with the patient's face. And I was actually surprised with the result. I mean, I thought it's gonna be awkward and it's not gonna be a success, but it turned out to be a good one, and I'm so happy for her. So in creating veneers, health is very important. It's a must. It's the #1 priority. Number 2 would be function. It should be functional. You can eat with your veneers, but of course you have to avoid eating super hard food, but ideally you can eat with it because it's a restoration and it's your teeth. It should be functional. And number 3, aesthetically pleasing. Okay, it's always subjective when it comes to the design. The patient sometimes would want to request a more super perfect smile, super white smile, bunny-ish. Yung iba gusto mapangil or something like that. Yung iba naman gusto fake looking. Yung iba naman gusto nila yung parang asymmetrical, yung smile. It's always subjective because it is aesthetics. Iba-iba kasi yung nakikita ng tao. Iba-iba yung people that surrounds you. Iba-iba yung perception mo about dental aesthetics. That's why mas maganda if, let's say for example, you know what you want and you really have to relay it to us. But there's always limitation because we cannot be able to get it 100%. For we consider a lot of things. It should be healthy. This is for you, for your own benefit. it should be healthy, it should be functional, and lastly, it should be beautiful. Pero yeah, we have to make sure that we hit all these factors when doing a smile makeover. Okay? So the patient is also thinking about the lower teeth, no? Kasi medyo hindi na siya pantay. And it would be a great idea for her to have her lower teeth done as well to be able to balance the shade and the color. Pero as what I have mentioned a while ago, it's always subjective. Kung gusto niya hindi perfect, like gusto niya taas lang, it's her call. As long as it is healthy and functional. So thank you very much guys for tuning in. I hope I could help you with this simple video to show you some possibilities, okay? Maybe you can relate with this kind of case or maybe medyo same situations. So, alam mo yun, there are always answers to questions and solutions to problems. It's really up to you if you will take any action to be able to get the result that you want. So God bless and happy Halloween!